The Virtual Curbside is a production of the Utah chapter of the American Academy of Pediatrics, the Utah AAP, working together to improve children's lives through education, advocacy, and networking. Hi, this is Paul Wirkus from the Utah AAP. Welcome to this week's edition of the Virtual Curbside, where we bring pediatric providers together with subspecialists to get smarter about all things pediatric and better acquainted as a community of caregivers. The Virtual Curbside is brought to you in part by a generous grant from Primary Children's Hospital. Primary Children's Hospital, the child first and always. Welcome back to the Virtual Curbside. Welcome to Season 8. We're amazed that we're still around and glad to dive into the next year. We want to do something special to start the next year, and we wanted to collaborate with some of our neighbors. We're very fortunate this month to have ophthalmologist and past president of the Nevada AAP, Mitchell Strominger, with us talking about conjunctivitis. Welcome, Mitch.
Hey, thank you for inviting me. My pleasure.
Well, we're thrilled to have you here. We've been trying to collaborate a little bit more actively with some of our neighbors lately and realize that there are a lot of resources we should be drawing on.
Well, we are closer than you think, although it's probably, an 8-hour drive from Reno to Utah.
Yeah, although I was in the south part of the state a couple of weeks ago, so that was nice. So I wanted to talk about conjunctivitis over the next couple of weeks. We should start off. Any disclosures?
I wish I had disclosure like any other pediatric subspecialist. I don't have much to disclose.
Well, we'll try to drum something up for you by the end of the month.
That would be nice.
Okay, we'll do what we can. So we want to talk about this because basically this is an easy topic, right? Somebody calls on the phone, says, my child has pink eye. Can I get some drops? You phone in drops. End of story. Isn't that right?
Well, that's what happens. That's what you would think, right? But,
are you going to argue?
Ophthalmologist, of course, I want to know what's going on because not all pink eye or red eye is the same, right? So the key is to try to figure out what's going on. So if you are going to send in a prescription for something, you better treat with something appropriate. And if it doesn't work, then maybe you better see the patient.
Right. And I think what we're hoping to argue over the next few weeks is that that's absolutely what we need to be doing. Let's start off by talking about what the conjunctiva is. Where is it and what does it do?
So the conjunctiva is a mucous membrane. And so it's an interesting structure because it covers front covering the eye. That's what you see. That's called the bulbar conjunctiva. And then it kind of also on the other aspect of it, it covers underneath the eyelids. And so that's called the palpebral conjunctiva. And the palpebral and the bulbar conjunctiva meet up in this thing called a fornix. So you have the fornix underneath the upper lid, and you have the fornix underneath the lower lid, and then a little bit on the side as well. And like any other mucous membrane, it protects the eye, right? Protects the eye from any noxious agent, but the eye is also interesting because it has to stay moist and lubricated. So it also has these mucin secreting cells that help produce your tear film. So your tear film has a couple components to it. One is this aqueous component, one is a mucin component, one is an oily component. And the conjunctiva has these goblet cells that produce that mucin component of the tear film.
And knowing that it produces mucus, I think helps us, for one thing, to want to think more carefully about what happens when we see mucus there. That is not necessarily a sign of infection.
Well, your tear film, you produce normal tears. So anytime any of that becomes excess, and then depending upon the cause of your conjunctivitis, that's going to give a clue as to what might be causing the problem.
And how does the conjunctiva relate to the cornea?
Well, the conjunctiva is that fleshy part that covers the eye. The cornea is the clear part that you see through. That's completely different from the conjunctiva. And the conjunctiva and the cornea actually meet up in this area called the limbus. So if you have like a brown or blue eye in your iris, you can see that the iris sort of all of a sudden ends. It ends actually at the limbus. And so that's the junction between the cornea and the conjunctiva. And the limbus is interesting because the cornea keeps regenerating itself. So we have these epithelial cells there that help protect the cornea. And that's what scrapes off with any corneal abrasion. But you have these limbal stem cells, and the limbal stem cells are really important in producing the epithelium that keeps the cornea intact and helps keep it clear. There's other cells that pump water out of the cornea, but we won't necessarily get into that today. But that's the difference between the cornea and the conjunctiva.
And probably some impetus to think about the infections in the area that things that affect the conjunctiva could also affect the cornea.
Well, yeah, if you have a bad infection that affects the conjunctiva, it can affect the cornea. We tend to be more concerned about things that infect the cornea, like corneal ulcers or things like that, because any infection that affects the cornea is going to cause your vision to decrease, right? So you need to have a clear cornea to see through. The interesting thing about the cornea, too, is the cornea is actually what refracts the light most. A lot of people think it's the lens of the eye. So the lens of the eye changes shape to focus the light. But the cornea is actually the most important thing that kind of helps refract the light. And therefore, you can have corneal diseases. The one we think about is something called keratoconus. So if your cornea is like a cone, then all of a sudden those light rays are going to be focused abnormally. And the cornea is where people have that type of surgery called LASIK to try and help focus the light rays to get rid of glasses. So it's a different structure, but you're right. I mean, if you have an infection there, it can be associated with infections in the conjunctiva or even vice versa.
So when the conjunctiva gets inflamed, what's going on there?
Well, it's like any itis, right? So we call it conjunctivitis, which is inflammation of the conjunctiva, and it's a reaction to whatever stimulus is causing. We think of conjunctivitis in a couple different categories. The biggest categories that we might think of would be some sort of infection, like a bacteria or a virus. But you can also have conjunctivitis that's associated with an allergic reaction or associated with a chemical injury. Or you can actually have conjunctiva affected by autoimmune problems. So it's sort of a wastebasket term when we use conjunctivitis. It's inflammation of the conjunctiva. And so the job really of the pediatrician is to help figure out what the cause is. And if they can treat it, that's great. If they can't, then it needs to be referred to an ophthalmologist to sort of help figure out what the cause is.
And as with any itis, knowing what the cause is going to determine the treatment.
Oh, absolutely.
There are lots of different things that can cause pharyngitis, and we shouldn't approach them all the same.
Right. Well, that's true.
Speaking of pharyngitis, let's start off by talking about the viral causes of conjunctivitis. What does viral conjunctivitis look like? I would also argue, I guess, that conjunctivitis is just one step more precise than pink eye, right? Pink eye, your eye's red for some reason, and now we're going to blame it on the conjunctiva. What does viral conjunctivitis look like?
Yeah, well, viral conjunctivitis, you sort of have this glassy appearance to the eye, along with the eye being red and inflamed. Most of the time, you don't have a lot of discharge there, but you can have some sort of mucoid discharge. So you can have some element of that with the viral conjunctivitis. When I see a patient who comes in with conjunctivitis, I want to take a good history and help figure out what's going on. So these are questions that I always ask if they're having a runny nose or a sore throat, or whether they're having an ear infection, or whether they're being treated for any sinusitis. So that helps me localize it. But in someone who has a viral conjunctivitis, they can have preauricular adenopathy and associated with this mucus discharge. And, it's funny because, I'm probably one of the only ophthalmologists that actually looks at the throat and feels for preauricular nodes, right? Most ophthalmologists don't necessarily do that, but in pediatrics, it's really important to help figure out whether it's a viral conjunctivitis. Viral conjunctivitis is one of those things you think about that spreads pretty readily amongst the population. And so it usually affects, sort of the older kids that might be in school. Sometimes it can start out in one eye and then go to the other eye. And the transmission rate can be fairly high. The statistics say it can be anywhere between 10 to 50%. But the thing about the viral conjunctivitis is that you could have been inoculated last week and finally 4 or 5 days later present with it. So sometimes you have to do a little digging and ask the parents, oh, was there anyone in the school who had pink eye or red eye, which is the term that most parents use, or sometimes the school nurses use that. Anyone at school have a pink eye or red eye a week ago or 5 days ago? And a lot of times the answer is yes. Or maybe someone in the family had it a couple of days ago and then now you get it. So it can be pretty contagious at times.
How long does it remain contagious? What advice should you give parents about how long to isolate their kids?
Well, there's a practical aspect of it. It's like anything else in pediatrics, right? You want to get the kids back to school as quickly as possible. The incubation period being about 5 to 10 days, and then it can be communicable for about a week. So I guess theoretically, you sort of need to keep them out a week, but I don't think from a practical standpoint, that happens a lot.
What's the outcome of untreated viral conjunctivitis? There's really not a treatment. What's the worst case scenario?
So there's a couple different types of viral conjunctivitis that we think about. Most viral conjunctivitis is actually transmitted by an adenovirus. And so the typical type is where you have sort of this pink eye, glassy with the mucoid discharge, preauricular adenopathy, and some pharyngitis. And then those kids tend to heal more quickly and tend to be back doing their normal thing. Sometimes you can have some discomfort and itchiness. So a lot of times I will recommend using an over-the-counter mast cell stabilizer type of drop to help. It typically goes away pretty quickly. But there are some forms of viral conjunctivitis that can be really severe and sometimes can actually mimic other problems. And so the one that comes to mind is something called acute hemorrhagic conjunctivitis or pharyngeal conjunctival fever. So these kids are really sick. It's also an adenovirus, and they have high fevers associated with it. And when you look at the eyes, they're really swollen. And it's typically both eyes, the eyelids are swollen, they're completely miserable. And I've actually seen kids admitted to the hospital because they thought they had some sort of orbital cellulitis, and they were being treated with intravenous antibiotics. And I was called to see this one kid in particular. And when I looked at the CT scan of the orbits, which you'd expect to see some infection spreading from the sinus, that would be indicative of an orbital cellulitis, the sinuses were completely clear. And so this was a bad case of viral pharyngeal conjunctival fever. These kids, obviously don't need to be admitted to the hospital for IV antibiotics. It's important to recognize them, but sometimes you have to do CT scans to rule out the fact that you might think it's orbital cellulitis. I mean, most time with orbital cellulitis, you have other things going on. You can't move the eye around. They're in a severe pain, things like that. The other type that you always have to be concerned about with viral conjunctivitis is something called epidemic keratoconjunctivitis. And I think this is a topic that most pediatricians don't quite understand, or maybe they haven't seen. And this is caused by some subtypes of adenovirus. And what happens is that in this case, the virus actually affects the cornea. So what happens when it affects the cornea, you get these things called subepithelial infiltrates, and they look like little white spots on the cornea. Sometimes it's hard to see them, but the clue about the fact that this might be epidemic keratoconjunctivitis is that the vision starts decreasing. The kids start complaining about problems seeing. They can have photophobia. They have more light sensitivity because now the cornea is becoming involved. So I always tell the pediatricians, it's great to just look at the eye, but you also need to know what the vision is, right? So if the vision is decreased, you have to really be concerned in any infectious process that now the cornea is becoming involved, and this is just not your typical conjunctivitis. So this is called epidemic keratoconjunctivitis. And if you want to, you could take your direct ophthalmoscope off the wall, and if you dial it into the green, that's a magnifier. So you have a light source, a magnifier. You can look at the cornea and see these little white specks there. And the problem with these things is that this can cause permanent vision loss. So anyone who has epidemic keratoconjunctivitis really needs to refer urgently to an ophthalmologist or pediatric ophthalmologist. Now, they're going to hate you because these kids can be very contagious. So the last thing you want in your office as an ophthalmologist is some kid who's spreading an adenovirus around. But the problem is that if you don't treat them, they're going to go blind and have permanent scarring. So unfortunately, we have to use steroids. Viruses love steroids, right? Because they multiply more. But the problem is we're dealing with the inflammation from the virus. So we have to use steroids in these cases. And sometimes we have to taper these steroids over months and months, preventing a relapse of the virus as you're tapering the steroid. But it saves the vision because it prevents scarring.
So you're talking about systemic steroids, not topical steroids?
No, topical steroids.
Oh, okay. Okay.
Topical steroids, yeah.
Okay. So working backward, definitely in any cases of vision loss, and probably in all instances, we should try to get a look at the eye as best we can when someone comes in.
And we are doctors, right? So that's what we do.
Yeah.
I mean, maybe AI will, Google will come up with some Google AI to have some parents stick their kid's face in the camera. But for now, it's best to examine kids. I mean, it's with everything else,
Right. These are true emergencies. Working back on the pharyngeal conjunctival fever, the case that you described, would there have been a way short of the CT scan that should have said this was a viral process, not an orbital cellulitis?
Well, the big thing I think is that the eye moved around normally. And the kid was not, even though it looked horrible, wasn't in that much pain. Because what happens is when you get infection that spreads into the orbit, the eyes don't move, right? It's affecting the orbital fat, it's affecting the muscles, and the eyes just don't move. So if you have a kid who is pretty verbal, they might complain about double vision. The other thing, if it's very bad, you also get proptosis. So look for proptosis and an eye doesn't move around very well. And that would be more concerning if the eye is inflamed of some sort of orbital cellulitis.
So you're suggesting again that physical exam may be an important part of what we do.
Right. I mean, the things that are important in the examination is check the vision and check the motility, check the pupils and look at the eyelid. So all those things can help distinguish what's going on. There's another thing we don't see very often in a kid. We see it more in adults that can produce some proptosis in a red eye, and that's called a CC fistula or acute angle closure glaucoma. We rarely see these things in kids, but that can also produce a pretty red hot looking eye. Unless you think about it, you might miss that.
One last thing then. So you mentioned that in garden variety viral conjunctivitis, that mast cell stabilizers may be helpful. What's the point there?
Well, sometimes you can get some itching with it. So an irritation. So this is all just supportive stuff. I don't think there's any paper or anything that's looked at using antihistamine mast cell stabilizers in kids with viral conjunctivitis, but you have enough of them that have some rubbing and irritation. And so you could use lubricating eye drops if you want. Some people take, a towel and run it under the cool water and put that on. So that sort of thing. The one thing I always tell the parents is that if it's a true virus, adenovirus, it's pretty contagious. So you have to be careful. You don't want to share bathroom glasses. You don't want to share towels. Make sure you wash your hands very good because this can be on a surface too. So if the kid's running around the house touching surfaces, then the last thing you want to do is touch a surface and then rub your eye. So be very cognizant not to do that.
It seems like the eye drops, you may not want to share those either.
Yeah, well, you shouldn't share any eye drops.
All right. So that just got us started. Thanks, Mitch Strominger, for spending some time with us this week. For your questions, please send your questions to questions@vcurb.com. Next week, we're going to talk about bacterial conjunctivitis. Hope you'll join us. Thanks, Mitch.
Thank you.
Thanks for joining us. We look forward to getting together again next time. The virtual curbside is available on iTunes or wherever you find your other favorite podcasts. Be sure to like us and subscribe. We want you to like us both because we're needy that way and because that will help other listeners like you find us. Check out our website, vcurb.com, for supporting materials, schedules, and other great stuff. The Virtual Curbside is an educational production of the Utah chapter of the American Academy of Pediatrics. The opinions expressed in this podcast, while carefully considered, are ultimately the opinions of the presenters and not necessarily of the American Academy of Pediatrics or our employers. And remember, the content of this podcast shouldn't be seen as a substitute for seeking actual personal medical care. If this is an emergency, hang up and dial 911. Otherwise, schedule a visit with a caring healthcare provider to try to get to the bottom of your concerns. None of this could happen without Elisa Stoddard, our extraordinary executive director of the Utah AAP. Many thanks to Tim Cosgrove for his help on the website and logo design. Thanks to Paul Wirkus, who composed the theme music. See you next time.